As the pandemic continues to grip the globe, a silent pandemic is seeing an alarming uptick that's raising red flags for health professionals like our next guest, a critical care specialist who is also a sexual assault examiner. She's affectionately called Nurse Noel. Thank you for joining us this morning.
Thank you for having me.
Now, this is concerning. Can you tell us what you're seeing where you are?
So I work in New Jersey, and so 1 out of 6 American women is a victim or survivor of sexual assault or an attempted sexual assault. And what we're seeing is that women and men are not coming into the emergency room because they're afraid. They are afraid of, contracting COVID. So we see a decrease in numbers
So
coming to the
how
emergency room.
how do you know that there is an increase? Are they reaching out to hotlines, resource centers?
So the National Sexual Assault Hotline, 1-800-656-HOPE, we are seeing an influx of calls. And for the first time, 50%, over 50% are from minors, we're seeing.
Okay, because that was actually my next question, which was, who are the faces? So you said that there's an increase in minors. Are they being sexually assaulted at home?
Yes. So because we have this stay-at-home order, a lot of the states have stay-at-home orders, including New Jersey, doesn't mean that it's safe at home. So stay at home. We are trying to get people to stay at home, but also to be safe at home.
And also because schooling is also taking place remotely, that first line of defense, those mandated reporters, which are teachers and school counselors,
Yes.
they're not having that interaction.
They're not, and it's unfortunate, but we advise people, we urge people, please just call the number 1-800-656-HOPE. So you can be prompted. There are certain things, like I'm a sexual assault nurse examiner, and what I do is from ages 13 and up, we do forensic data. So what we work with the prosecutor's office to collect data. So we get swabs, we get samples, we provide STD treatment, the morning after pill, antiretroviral medication, and we provide counseling also and resources.
So you're saying because of the pandemic, the victims are not going into hospitals. And
Yes,
if they were to go into hospitals, there are resources that you would provide them with. For example, like you said, the morning after pill. So are you saying that
absolutely.
we may have a host of other issues after this pandemic is lifted?
Yes, we are seeing a rise in sexually transmitted infections. We're seeing a rise in unwanted pregnancies, and we're just seeing a rise in mental trauma that it causes from being sexually assaulted and abused.
And so we could also see a rise in children being abandoned as well.
Yes.
What do we do, Nurse Noel? How do we fix this issue? I mean, we're still in a pandemic, vaccines are on the way,
Mhm.
but what do we do in the meantime to help our neighbors who could be hurting in silence?
We encourage them to call the hotline, to talk to people. There's so many resources that people don't know about. I am a sexual assault nurse examiner, but I'm also a sexual assault survivor. So I wish I would have known the resources that were available to the public when it happened to me. But now people are more talking about it more. People are more vocal. We have a little more assistance. We have social media, help groups. It's a plethora of different things that people can do.
And as you said, Nurse Noel, there are people that are talking more, but there are also people like yourself who um, are silent and don't want to talk. Can you just provide some light at the end of the tunnel for someone who may be listening?
So, as a survivor, as a sexual nurse examiner, and also as a survivor, you are not alone. I just want to I'm looking at so many people, so many women, so many men, so many boys and girls. You're not alone. There are resources, there is help. And if we band together, we can definitely overcome this.
Nurse Noel, I read a startling statistic. Every 73 seconds, an American is sexually assaulted. Can you, again, please just point to some resources for our audience members who may be listening?
We have RAINN, RAINN.org, and we also have the National Sexual Assault Hotline, which is 1-800-656-HOPE.
Nurse Noel, thank you so much for joining us this morning and shining light on such a, I'm lost for words. All I can do is pray at this point. Thank you, Nurse Noel, for
Thank
joining
you.
us. Have a good day.
Thank you.